Hi, this is the show that you must watch. If you've never watched any of our other shows, this is the one you're going to find out the most information that's going to be useful to your life. There's a new book out called Nutrient Power, and it's written by Dr. William Walsh, who we're going to call Bill today. And I'd like to thank him for joining us. I've been waiting for him to do this for the last, I say 4.5 years at least, right? Dr. Walsh, thank you for joining us.
Well, thank you for inviting me on your show.
You know, you've been on the show before, 12 times.
Really?
Yes, you have. And it was almost 10 years ago, I think, that you were on several times because you've done so much research about the brain and chemistry and behavior. And so you have this new book out, which I think is wonderful because having worked in psychiatry for 6.5 years in a hospital, I felt that a lot of the drugs were not the greatest thing that people were taking, both for their physical bodies and for their spirit sometimes. And you have found natural ways of dealing with Alzheimer's, autism, mental disorders, right?
Right, right.
So tell us about this book.
Well, one of the interesting things is that the book basically uses a lot of the wonderful research that's been done by pharmaceutical companies. The problem they have is that they have the wrong goal. They are doing wonderful scientific research, understanding the processes that go on in the brain. They understand so much about many of the mental diseases, but their goal seems to be always to find the billion-dollar drug instead of trying to find a way to normalize the brain. And I first got interested in this working with violent people out of Stateville Penitentiary. I was a prison volunteer while working at Argonne National Laboratory. And while we were naively trying to help these people as they were getting out of prison, to help them succeed after they got out, we began to realize that in talking to the families that had produced a criminal, that many of them said that they had other children who were just fine, and that this child was different from the time he was born. And that they talked about a child who, by the time they were 2 or 3 years old, might be torturing the family pet. I met a couple of families said that their child had actually murdered the family pet, and they said that they often had counseling. Many of them had had counseling before they were in kindergarten, and had psychiatric therapies, and then and it seemed to them that the child was headed for the prison from the time they were born. And that's how I got started. We began to realize we didn't understand what we were doing. We didn't know what the causes of behavior disorder was. So that's what started all of this. I started doing experiments at Argonne National Laboratory, looking at the body chemistry, the blood, urine, and hair chemistry of people who were very violent. So that's how we began. It's now about 30 years later, and I now have, we've expanded into studying people with schizophrenia, violent behavior, bipolar disorder, depression, anxiety, and a wide variety of mental disorders and behavioral disorders, and most recently dementia. And I've founded a clinic called the Pfeiffer Treatment Center back in 1989, and while there and at other times I've worked directly with about 30,000 patients, many of them who are just terribly ill and with great problems. I've seen more than 3,500 patients with schizophrenia, more than 6,500 with autism. And my thing has always been to collect as much chemistry data as I could. And so one thing that's really helped us is I have these gigantic databases of chemistry information for depression and schizophrenia and the various conditions. One thing I found is that, take an example of depression. Mainstream psychiatry throughout the world believes that depression basically is a single condition, that there may be variations on it, but there's a central theme, and the central theme has to do primarily with serotonin neurotransmitter activity. Well, what my database says, and I have nearly 1 million different chemical analyses of people with depression, it's pretty obvious that depression is an umbrella term that incorporates many completely different conditions. And what I think the most exciting thing for me recently is to study is to learn what is coming from the new science of epigenetics. We now know that it looks like that cancer is primarily an epigenetic disorder, and we could briefly talk about that if you would like. But it looks also that many forms of mental illness and depression and even forms of criminal behavior, result from environmental insults that alter gene expression and alter your brain chemistry.
But it has to be there to begin with in your DNA, or it doesn't?
It doesn't. Actually, you can have perfectly healthy DNA, and if you have a environmental insult, either before you're born or sometime afterward, it can alter the functioning of these genes. You could have individual genes that are supposed to be turned on and producing proteins in some part of your body, and this could epigenetically change its behavior. So it can take perfectly healthy DNA and alter the functioning of it.
Well, I know I went through your testing before we did the shows before, and I found out very interesting things, and I even had some of my relatives go through it too, and it was very interesting to see who had what and how it came down certain lines and what could be corrected. You also did some things at the time that had to do with menopause and how that affected women.
Right. We found in the case of depression, one of the 5 leading types of depression has to do with metal metabolism disorders, especially women who have elevations of copper and zinc deficiency. Well, they tend to have hormonal disorders because copper is related to estrogen. And so that actually is one of the 5 major types of depression. There are others, the methylation disorders. A person can be over-methylated or under-methylated. Methyl is the simplest organic chemical in the body, carbon with 3 or 4 hydrogen atoms. And the amount of methyl in your body has a lot to do with your personality and has a lot to do with certain diseases. Then there are also toxics. Metal toxics in particular can be the cause of depression or even schizophrenia in some cases, and certainly Alzheimer's disease. So it's been for me, it's been very exciting for me to gather all of this information and to be able to put it together scientifically.
Well, I know the book you had me read at the time was by Dr. Carl Pfeiffer, who in the 40s had discovered many of these things and how zinc made a difference in a little girl who was eating oysters, I think it was, right?
Yes.
And she had schizophrenia, and this showed. And zinc, you can tell if you have a zinc deficiency, because I had one, because nails break, or when you comb your hair, some of your hair comes out on the comb, things like that. But I even had one of my relatives go to you. There was a child who was having outbursts. Sweetest kid in the world, had an outburst every time he ate a piece of pizza or something, and you had a powdered combination of vitamins that he took that completely balanced that out.
Yeah, well, for us, it's a medical procedure, and what you need to do is to do careful laboratory testing and then learn as much about the patient as you can, learning their symptoms, their traits, et cetera, and from that, find out what has gone wrong with their brain chemistry.
You had I felt like 1,000 questions that you answered.
We do
more than we ever did in the hospital asking people things.
Yeah, we do need to know everything we can about a human being to really understand what their disorder is. And the name of my book is Nutrient Power.
And it's right here.
And the reason I gave it that name is that you don't necessarily need to have a psychiatric medication to help somebody with a mental problem. And in fact, I think the use of psychiatric medications will gradually fade away with time. I think as science advances, we'll learn ways to normalize the brain rather than putting in foreign molecules that do not produce normality.
Well, one of the things that they started giving years ago, and lithium, and they were saying something about, does that come from sea salt or something now? But anyway, lithium did calm people down, but all of these things have tremendous side effects. And that's the thing I think people don't pay attention to.
Well, the problem is that they may be putting a SSRI like Prozac or Paxil and giving that to a depressed person to increase the serotonin activity in the brain, which in fact can assist with depression. The problem is there are more than 100 neurotransmitters, chemical neurotransmitters in the brain. That treatment doesn't just affect one of them. It affects many others, and that's really what side effects are. And I don't think we'll ever come to a time when psychiatric medications will be free of side effects. And I think it's time to go in a new direction.
Because it affects other organs of the body. and as every drug does.
Other organs of the body and other parts of the brain.
Well, I thought it was interesting. I met a woman at a seminar, a young woman with gray hair, and I asked her why she didn't dye her hair. And she said because of the fact that she had all of these symptoms and aches and pains and everything. And I had her go through your testing. And I went to Florida, and she called me up in a week and said she was sleeping better. She could do her artwork. She had all this energy. And I said, come on the show and tell everybody about it. She said, I can't. My husband's an executive with a drug company. He doesn't want anybody to know that, that the vitamins cured me, you know.
But it has to be done scientifically. And one of the big surprises for me early on in clinical work was learning that it's not just deficiencies that cause problems.
Excess.
It's a lot of people genetically, because of genetics, may have an excess of a nutrient, and that can be even more serious than a deficiency. And that's why you cannot just take a person who's ill and stuff them full of terrific nutrition or stuff them full of vitamins, minerals, and amino acids and expect them to get better, because many of them will get worse. So the key is to find out what a person's individual biochemistry is. Try to identify which neurotransmitters are either too active or too inactive, and then to develop treatments that will normalize their brain.
And you do that through hair analysis as well as blood testing, right?
Well, early on, I did a lot of forensic studies. We actually got hair samples from people like Charles Manson and Richard Speck and a lot of criminals, and that was that is very helpful for behavior disorders and for forensic studies. But most of the work we do now involves blood and urine chemical analyses, and my book actually doesn't even mention hair analysis. And the reason is that I really think that in order for this kind of clinical approach to really hit the masses, it has to be taught in medical schools. It has to become something that the mainstream medicine will believe in. And I've learned there are a few things that can just make mainstream medicine people upset, and it's best not to do that. One thing is to say that if you mention hair analysis, you will lose them completely.
You know why? Because the minute you mention hair analysis, people often ask me, well, are you checking for drugs? Are you checking for cocaine? Are you checking for marijuana? You know, and things like that, and they don't realize
and I have done that.
Right, and it is possible, but that is not what you checked for before. That is not what...
We were looking for mental metabolism disorders, and for ADHD and for behavior, that was actually quite effective, quite useful. We found trace mineral patterns for people who had antisocial personality disorder, the so-called sociopaths or psychopaths, had a distinctive pattern of trace metals.
Which was what? What kind of a distinct
Well,
pattern?
the sociopaths were actually low in copper, they were high in lead and cadmium, and they were extraordinarily high in sodium and potassium. And it's and then eventually the great Carl Pfeiffer invited me to bring criminals to his clinic in New Jersey, and he did a complete metabolic study on them, and he found that they were all low serotonin activity, found they were all undermethylated, they all had something called a pyrrole disorder, and he found a very interesting combination, sort of a spooky combination of chemical imbalances that were all quite serious and seemed to be associated with people like that.
And cadmium, doesn't that come from car batteries or something? Because I remember with my nephew when he was tested that he had that, and his bedroom was over the garage. And that's what I could figure out, is that it must have been coming from the car.
Well, cadmium is, we're all exposed to cadmium, and we all have some cadmium in our body. In fact, the average person has something like 200 of a ppm of cadmium in their body. And your body has special proteins that are terrific at getting the toxic metals like cadmium and lead out of your body. But some people don't have that capability. We're all exposed. People who smoke cigarettes have double the amount of cadmium of other people.
Wow.
And if you happen to be working in a body shop or working with metals or fireworks, or even people who use paints that might have cadmium blue or something, they can get in trouble. They are prone to too much cadmium exposure.
What about beauticians?
Well, beauticians, yes. And of course there's dentists and dental assistants and the problem they have with mercury because of the amalgams that they're working with constantly.
Now, what about aluminum? Because I actually, when I was talking to you before, I met a woman that I had known before, and she had absolutely no memory. And I said, you better have your test done. And she did have an excess of aluminum in her.
Well, aluminum is very controversial. About 25 years ago, there was a lot of research that indicated that aluminum had everything to do with Alzheimer's disease. Then that got discounted after more research, but I've noticed it's making something of a comeback, and there are now more and more scientists, probably still a minority, who think that aluminum has a lot to do with dementia. But certainly, we know that dementia has a lot, like Alzheimer's, has a lot to do with oxidative stress, and it has a lot to do with toxic metals.
What do you think it is that causes Alzheimer's? Because you've come up with something that people can
Well,
take, right?
my book, chapter 8 of my book, is on Alzheimer's disease, and I review all of the leading theories, and there are about 8 different theories. There's the amyloid plaque theory, that it's caused by this gunky white Elmer's glue-like substance that they find in the brains of Alzheimer's, people who die of Alzheimer's. Then there's the tau theory. The original theory had to do with acetylcholine, and most of the medications are still based on that. But what I think it is, I believe it's an epigenetic event. I think that there's a variety of toxic exposures or insults that can alter gene expression, and that the protectors in the brain that protect us against, that protect brain cells from dying, which is called apoptosis, that these protectors are no longer genetically produced, and so we lose protections. Also, the blood-brain barrier of people with dementia seems to be weakened, and so more toxics can enter the brain than they're supposed to.
So how do we prevent that?
Well, I think we can prevent it mainly by, there's a number of things you can do to reduce the chance of Alzheimer's. One of them is keep your brain active. They know that they know that people who do crossword puzzles or learn a language or just keep their brains active are far less likely to develop Alzheimer's, which means just sitting on the couch and watching TV could be dangerous to your health. Maybe I shouldn't say this on a TV program.
But unless you're learning something like you are here.
But also, I think antioxidants. I think that the body, most human beings as they age, lose these wonderful high levels of antioxidant proteins and other chemicals, and I think that tends to cause brain cells to die more quickly. So I think antioxidant therapy is certainly important. And then I patented I submitted for patenting a treatment for Alzheimer's that involves increasing the genetic expression and functioning of a particular protein that seems to have everything to do with Alzheimer's. It's called metallothionein, and we've now given this treatment to about 150 people who are diagnosed with Alzheimer's, and about 70% of them get part of their memory back, and then they stabilize.
This is a capsule?
Yes,
So?
it's a combination of 22 ingredients that I derived from other people's research, people who are doing research.
And you can get these without a doctor's order?
You can.
Okay.
You can. And at any rate, what happens is after they stabilize, it doesn't take away their Alzheimer's. They, for example, maybe somebody had gotten to the point where they no longer could remember their grandchildren, and then after you would do the treatment, they might have that part of the memory back. But then they would stabilize, and then after a few years, they would lose the diagnosis. Their doctor would say, "Well, it can't be Alzheimer's." And the reason is because they didn't deteriorate and die.
So the trick is to take that before you have it.
Well, that would be good.
Yeah.
And they're now developing new genetic tests that I think are getting better and better, and they'll be able to identify for people who is at risk for Alzheimer's.
So is it usually in the family? You're talking about the DNA, or you're saying it's more of an environmental insult, as you call it?
Well, you can have a predisposition for Alzheimer's that can be triggered by an environmental insult.
Mm-hmm. So what environmental insult would cause that?
Well, I think there's a variety. I think toxic metals could. We also know that that people who've had diabetes are far more prone to Alzheimer's. There are a number of physical conditions that have a lot to do with Alzheimer's. We know that Alzheimer's, the brain cells that begin to die in Alzheimer's occur very close to blood vessels in the brain. We think that has a lot
So
to do with it.
exercise would help?
Exercise definitely would help, and being in good physical condition definitely would help.
You know, I've been reading lately that magnesium has quite an effect on our body, and so does iodine. How do you feel about that?
Well, magnesium certainly does. If you're low in magnesium, you'll be prone to a lot of problems, both mental problems, you'll be more prone to cardiovascular problems. Iodine is something else that is absolutely essential. You need iodine for your thyroid to function properly. So you don't want to have too much or too little of this important nutrient.
What about the effects of the sun? Have you done any kind of research or anything? Do you have any feelings about the effects of the sun on all this?
Well, one thing that's everybody is talking about these days is vitamin D. And you get vitamin D is manufactured naturally in the body if you have a lot of sunlight. I have a program where I'm training doctors internationally. I've got a program I've been to Norway 3 times. And it seems like everybody I see in Norway is vitamin D deficient. Extraordinarily so, and of course they have very little sunlight there. They also have 4 times the typical rate of schizophrenia and suicide in Scandinavia. And I think it has a lot to do with sunlight and vitamin D.
That's interesting you say that, because I remember when I first started working in psychiatry, one of my first jobs, there was a young man, an engineer, who was just a very handsome, smart guy, and he went to Norway to work, and he developed schizophrenia in his 20s. And came back here and had to be treated for it. And he had never exhibited any symptoms before he was there. So it's interesting you say that.
So that's a possibility. I mean, it's not for certain, but it seems like we know that sunlight has a lot to do with vitamin D, and that people with vitamin D deficiency, at least in the testing of the thousands of people I've tested, most of the people we see who might have depression or even schizophrenia tend to be low in vitamin D.
Now, what about sugar? Because I remember you saying once before, you know, they really want us to eliminate sugar in everything and flour. But I remember you saying once before that we do need to have some of it.
You can't eliminate sugar because all the energy for your brain comes from glucose, which is what sugar becomes in the body. And so what you need, the body needs a steady supply of sugar. And the thing that can cause a lot of problems are what I call quick sugars. For example, alcohol, or when I was a kid, I used to like sugar sandwiches. I mean, for some people...
Sugar sandwiches?
Yeah. I have a sweet tooth, I'm sorry. But the point is that what the body needs is a steady supply of it, and that's why people who have a problem with glucose control, who might be diabetic or might be hypoglycemic, what they really need is a steady supply of sugar, and not to allow your blood levels to go too high or too low.
Like from fruits and vegetables, I mean things that will have fiber in them so that they don't release as quickly?
Yeah, you need to have foods that have more chemical bonds, like complex carbohydrates. Complex carbohydrates turn into sugar, but they do it it's like time-release sugar, which is exactly what the body needs.
Well, I want to talk, we have 5 minutes left, and I want to give you a little bit of what some of the other people have said about this breakthrough book as a bridge from epigenetics and molecular biology to a biochemical psychiatry based on nutrients. It guides us through the rich biochemical tapestry and healing capacities. Now here's another one. This is from an MD. As an integrative psychiatrist, I have been following genetic aspects of mental illness for some time. One of my favorite sources of information, as is mine, is the information of William Walsh, PhD, an internationally recognized expert in the field of medicine. Nutrient Power, this book, describes individualized nutrient therapy treatments that have produced thousands of reports of recovery. And over your impressive career. And you have the Walsh Research Institute, which we're lucky enough to have here in Naperville, Illinois.
Right, we're a not-for-profit public charity, and we continue research. We have a program of training doctors around the world. In 3 weeks, I'll be in Cornwall, England, working with people. I'll be in Dublin in 3 weeks. I'll be in Australia next year, training about 50 doctors who will sign up for an intensive program of learning how to do these therapies. And we can't help everyone, but our scientific outcome studies, what we know, the people that we can help are, first of all, the easiest people perhaps are people with behavior disorders. Children with violent behavior or behavior problems. That is probably the easiest kind of patient to help.
Because punishment doesn't help because they can't control it, right?
Well, you need to have a steady hand, and you have to have competent parenting. But there are some marvelously wonderful parents who have children, many of them who might be adopted, who have just wild, horrible, even homicidal behavior. And so and if a person has a severe chemical imbalance, you can't love it away. And you might need to find out what's going wrong with their brain chemistry. So behavior, certainly depression. All forms of depression, I think we're really good at identifying what type of depression a person has and treating it effectively. Schizophrenia, we can usually provide benefits to most of the people we've seen who had this terrible disorder. And to me, there's nothing quite as exciting as seeing a schizophrenic become well.
Yeah, because they go through torture. They hear voices, they see things, they're delusional, they're
That's right.
dangerous, and they're unfocused.
Well, I don't think they're particularly dangerous compared to most people. I mean, I think that's not really true, but there, of course, like every other part of the population, there are some who are dangerous, and I've met a few.
Well, the ones I had were in the psych unit already, so they were
Okay, so-
dangerous. Yeah.
Yeah, and about 5% of people in the Illinois prisons are schizophrenics. About 5%.
You know, we're talking a lot about food and supplementation too, and I've been at a couple of restaurants lately that utilize farm fresh food. One of them, I don't know if you've been there yet, is Bakersfield, which is on Ogden Avenue near Cass Avenue, and they actually have a grocery store across the street that they bring in food that has a lot of organic food. Another one is this Nietzsche, which is in Geneva, Illinois, and I think they use the Bull Run Farm. And another one is at the Marriott. It's a new one that's in the Marriott in Naperville, right there on Deal Road. And they all have chefs that are using organic food. So if you're looking for some place to eat that has these things available to you, because there's a lot of processing that's done in other foods which has a lot of chemicals, which I'm sure are not good for us, right?
I agree.
Okay. We've been talking to Dr. William Bill Walsh. He wrote this book for all of us to read called Nutrient Power. It would be of a benefit to anybody who has any kind of mental disorder, anybody who has possibly knows somebody with Alzheimer's or children with behavior problems or whatever. And it's a very helpful book, and we will be talking to him again. I hope you've enjoyed this. I've waited a long time to get him here. So thank you, Dr. Walsh. Thank you for joining us.
Well, thank you, Karen.
And we'll see you next time. Thank you.